Good afternoon, everyone. Thank you very much for inviting us as a representative of all of us research program of the National Institute of Health. I was looking at the agenda and I saw some of the speakers and people who are here. And it seems like many of you are either familiar with the All of Us research program and the precision medicine, or work with us directly or indirectly. And if you do, just can I see some hands? Okay, 1, 2, 3, 4, 5, 6. Okay, great. Well, I think I do have 10 minutes, right? Okay, well, I'm gonna go run through it. But what I wanted just to go over first is just to give you how this program started and where we are and what we've done in the past to make it successful as we think it is, and where we are today and what we need from you. So the first thing I want you to take away from here is that all of us has 3 websites. Okay, there's 3 websites. So one is and I'm mentioning this because people always ask me this question. Where is this information? Because there is, number one, the NIH website of the All of Us research program. If you go to that website, you will see a lot of information about the type of announcements, funding announcements we put out earlier, who we funded, who are our partners and their partners. You will see that. You will see the different aspects of the program. You will see the staff persons and all of the other things, and press releases and funding announcements and who we funded and whatnot. So that's that. But there is also a recruitment website, which this is the one I want you to remember. It's called joinallofus.org. Joinallofus.org. So we are all of us, just to join. Joinallofus.org. It's easy to remember. And on that website, you will see it's for recruitment website. And that is the one that is for primarily anyone who's interested in enrolling in the program. There are videos, there are print materials, there is a community page, providers information, all types of information is there. So people can actually go online and enroll online. So now, I know this is a health disparity conference, and one of the things that generally comes up is how do people enroll in the program if you only are web-based? Well, that is true. It is a challenging, but we do have and various programs that mitigate that aspect of it. And so number one is, how many of you know National Library of Medicine? Okay. You know that is like a repository of a lot of great information, written in multiple languages, easy to read materials, videos of almost every type of disease, right? So we are partnered with them, and they have a network of libraries around the country who then work with the local libraries. So we bring in All of Us research program to these libraries, okay? So that individuals who don't have an access to either internet or a computer can also be able to enroll, okay? So that's one of the things we're doing. The second thing we're doing is we're funding community partners across multiple areas in the country, multiple areas. We are funding providers, faith-based institutions who have a national reach, community organizations that serve African Americans, Asians, Latinos, and LGBTQI communities and whatnot. So we're funding a lot of community groups to help us, number one, educate people enough so they can make informed decision whether to join the program or not. Isn't that what we always do? Like, we give people the autonomy to make that decision by making sure that we educate them, give them the adequate enough information they can make a sense of it, and so that they can just make their personal decisions. And so we have the community partners, but we also have a mobile engagement assets, which I don't know who coined this, gave the name to this, but it is a unit, a bus, like a mama van, those kind of stuff that go out to the communities, educate them across the country, by the way, and educate them. And also one of them, we have 2 of them, one of them actually has the capacity to collect biospecimen and do physical measurements And so we have that also. Community groups can request those things, and we are in over 30 states in the country right now, where we have a presence. We have healthcare providers that are enrolling their physician groups. You can tell that I generally speak rather than use slides, because there was someone who once said that, have a conversation with purpose. And so this is what I'm trying to do here, have a conversation with purpose. So I'm going to go through the slides just to give you a quick understanding of where we are. This program started at this time. This was January 20th, 2015, in the President Obama's State of the Union, where he just talked about the importance of improving healthcare for all. And then following that, I believe that was within 5 days or so, the president also convened a group of stakeholders at the White House to talk about the importance of this program. And one of the things he said, as you can see, is what if matching a cancer cure to our genetic code was just as easy, just as standard? He also talked about what if figuring out a dose of medicine was as simple as taking out temperature. So many of you wearing eyeglasses, you go to your optometrist or ophthalmologist or anyone to give you your prescription for eyeglasses, and yours is different from mine, and mine might not work well for you. And so the idea is, how can we get closer to that in medicine, in treating all the diseases and conditions that we have, and also be able to improve healthcare at the same time. So I saw the sign that says I have 5 minutes. Okay, so then following that President Obama's meeting with the stakeholders at the White House, Dr. Collins formed a working group, and that working group developed this mission and this idea that we have here, which is number one, and we are one of the finest hospitals in this area, if not the country, and there are thousands of probably research that goes on here. Oftentimes, researchers have to do what? They have to get sponsors, people who fund them. And that has a limit in its own. It might be 5 years, 10 years. I was a Johns Hopkins research manager. It's never always. There is a cap to it. And they have to recruit people. They have to develop the entire research infrastructure. And that takes years. And oftentimes, they may not lead to much understanding of that. We all know that this is a problem. The idea of all of us research program is let me go back for a second. The other thing is that a lot of the data collected from this is not diverse. We don't have enough diversity in these research studies. So what are we trying to do? Well, number one, we want to make sure that we recruit over 1 million people, 1 million or more people from all walks of lives. 18 and up right now, but we're working on a birth to 17. But we're not there yet. We're working on now 18 and up. And that's number one. How can we have a robust diversity? That's number two. The third thing is, how can we have a data set that I've heard that electronic health records, I've heard that by specimen collections, the importance of that, and also we're even collecting the Fitbit data. I'm enrolled into the program. They have my I consent with my electronic health record. I answer SNAP questions periodically. I provided by specimen. They did physical measurements and whatnot. And I'm also providing my Fitbit information. So that the idea is collecting data sets that is as diverse and robust as that researchers would be able to use. So having said that, why are we doing that? The idea is to provide this information, this diverse data set to researchers to expedite a breakthrough in prevention, diagnosis, and treatment, and survivorship. That's the bottom line of this. So the data will be available to all researchers across the country and across the world who are going through a vetted process and meet the rigorous standards. That's what we're trying to do. So we have, how can you fight diseases, be part of the movement? How can you ensure the communities are included and an opportunity to learn? And we didn't just come up with these things. These were based on the work that we did prior to even implementing the program, so that the people from diverse communities inform us why would they join a program like this. So we all know this. How can we prevent a chronic pain that affects more than 100 million people without having all the side effects that we know? And much more of that, how can we slow or even stop the different types of dementia? We also know that a lot of groups are hesitant to join, ethnic and racial minorities particularly, and people who have been a victim of research that were not beneficial to them, and even not just beneficial but harmful. And we also know that. So one of the things community partners told us is that when they go out, for example, one of the groups that we fund is Delta Research and Educational Foundation, which has branches across the country, is that when they go to the communities and speaking about research to African Americans, they've learned that they can't talk about all of us research without first talking about the past, like Tuskegee and whatnot, okay, or Henrietta Lacks. So they talk about that before they pivot to all of us research program, because if you talk about research, according to what the community partners tell us, and this is like outreach and engagement activities of hundreds and hundreds of events, that this is what you need to talk about. You're not, hiding it under the carpet or anywhere. You need to come, right out of the gate and say that we know research has not been beneficial in African American, not all research, but research have harmed in the past some African American communities, and point these specific examples that people already have in their mind when they're talking to you. So we're trying to be a candid and upfront and fearless and pointing about what happened in the past and what we put in place today to prevent such things. So, and that is very important. So this is our value, and we didn't just come up with this. This is based on pre-work that we did. And again, if you go to our government website of All of Us Research Program, which is part of the slides, you will see that you will be able to access this information, learn about it, how we did it, and whatnot. It's open to everyone. You don't have to be a citizen. You don't have to have a Social Security. You don't have to do none of that stuff, as long as you live in the United States. We haven't gotten to the point where we can enroll Americans overseas right now because of the security, internet security team and whatnot. I'm not involved in that group. My job is to work with the community partners and other groups just to engage communities and enroll them and whatnot. So it's open to all. Diversity is our case, and I think we have a participant partners, by the way, and we have over 30 participant partners that are in all phases of our governance, who are helping us decide what type of data we collect, test the information that we're putting out, and guide us through the process with the rest of the consortium. So as I mentioned earlier, diversity in demographics, data, and health status. So these are our community partners. You can see that we have across the country, except maybe some states we don't have any representation yet, but we're working on. We have what people, by the way, can enroll online. And people can also call a company called EMSI to come to their homes to do the PMP, physical measurements and biospecimen collection. They can do that. But we don't have brick and mortar centers there. So we're working with Walgreens and QTC and other groups to be able to help us that, so the people in the communities can go there. We have federal qualified health centers across the country. And so this is our mobile unit. As you can see, it's we're working with one of the finest institutions that does learning when it comes to technology, using hands-on materials at the University of Utah about genomics to teach people about precision medicine. And we are working with the Library of Medicine, as I mentioned. People can enroll in multiple ways. This is one of the slides I want to show it to you. As of within a year and a half, less than 2 years, we have recruited over 215,000 core participants who went through every aspect of the protocol. Every aspect of the protocol. And we have additional number of people who have not gone through every aspect of the protocol. Remember, this is a study where people can enroll to the extent they want. Okay? People can enroll just to answer questions, skip questions, and decide not to give a blood work or give blood or do physical measurements or share the electronic health records. But they can come back later and do it. And we've seen examples of such thing. So as you can see, our percentage of African Americans, Hispanic, and I can show you the rest of them. And that's where I want you to go to research all of us. is one of the websites. You will see our data is not as current as of this. So we're talking about 21% of African Americans in our study. We're talking about 17, 18% of Hispanics enrolling in our program. So we're doing. If you look at sexual and gender minorities, there's about, according to the data, there's about 5-6% in the nation known as sexual and gender minorities. We are going around 9 and 10%. So people can enroll online, open an account. These are the type of information we're collecting in the surveys, as you can see all of that. All right. There's the mood apps and other things that are coming up. Cardiorespiratory fitness through integrated apps and so those are some of the work that we're doing and research of all of us. So if you are how many of you do research or anybody? What about if I say citizen scientist? Anyone familiar with the concept citizen scientist? Anybody? Okay. My daughter and my kids, when they were young, I mean, he's going to law school now, but my daughter's finished high school. I like to brag about that. Thank you. Is that when they were kids, we joined Cornell Ornithology Lab. Anybody know that? The biggest in the world. The idea was you go to your backyard and you try to record the birds that you see in your back, take pictures, load it up out on the website. Okay? Sometimes we'll go to the parks, we'll write where we are and whatnot. So this is very important. Why? Because researchers are not everywhere. Data collection tools are not everywhere. We need citizens who can report from their communities. Tell us what's going on in their communities. So everybody is capable of doing a research. It doesn't belong to one group or the other. So it's very important so that we are pushing this citizen scientist idea and also just because we feel like everyone has something to contribute. So please, go to these websites, learn about what we do, spread the word. My accent gets in the way sometimes. Spread the word, and if you haven't joined all of us, visit joinallofus.org, download the app, and with that, I would say thank you very much.